one of the things I reflect about a lot is how do we manage decision making if we think fear, if the family is making a decision out of fear, as opposed to just the safety of this is what represents for love to me, and this is what's most important to my child. And I do feel like sometimes just the framing of the question, um, if a family doesn't feel safe, can lead families sometimes to provide the response that will be most acceptable to the medical team, what they perceive as will be most acceptable to the medical team. And um, I can think of several scenarios where my concern was because the framing of the question included judgment, that families responded differently than I would have anticipated based on everything that they've shared with me. And when I say judgment, if you start a question saying, I understand you've had a lot of family meetings, and I've understand that this is what's most important for your daughter Terri. Um, but I've taken care of many children like Terri, who respond to these therapies. So are you sure that you don't want to try again? I just want to make sure. I know you've had a lot of family, but I just want to make sure. Well, what? You want to make sure what? That now that you're saying it, I really got it. And so one of my pet peeves is the number of family meetings we have sometimes. And when you're on service and you're navigating hard conversations, you do want to make sure that the decisions, the medical recommendations you're making, everybody's on the same page and then the family really understands. But I also think that we have to trust that the conversations that teams have had, families have had many conversations. Families have done a lot of work to get to these decisions. And so to have a new person come in to have a meeting, just to have a meeting, so you heard it from me too, because I'm really good at this. So you need to hear from me too. It puts families in a very challenging situation. And I have been on the other side where families have shared that I'm so tired of trying to justify my decisions. I know that there are other children who have this diagnosis and families are doing XYZ, but for us, that is not consistent with the quality of life we don't want that kind of technology, or we are not going to be able to support these resources, and we don't want that. But if people keep bringing it up as the best option, I do think that sometimes families feel not safe. I always say safe. I think about, are they afraid? But I just mostly feel like people aren't safe. And so what I share with the residents is that you're in a relationship with families, and that's a privilege. And it's a privilege for somebody to be vulnerable enough with you to share a decision that may be different than the decision you believe you would make. And if they don't feel vulnerable enough, they don't feel safe. But I also understand that people can change their mind. And so I tell teams all the time, like, families can change their mind. They can change their mind at any point. It doesn't matter what's on the paper. They can choose yesterday and no tomorrow. And like, we have to be able to honor that. I mean, people can change their minds. So I have to remind myself that too. But I do worry sometimes that our framing, I know framing around consents for procedures. We just had a discussion about this, a family we feel very comfortable with, but just the framing for consent for procedure from a different service changed the entire code status. And I'm not sure the family was comfortable with the change, but they were, in that moment, they felt like that was a decision that they had to make. And people get exhausted. There's a lot of this decision fatigue is very real, and I don't think we as clinicians recognize how many conversations sometimes families have to have to try to justify their decisions as they understand them in the moment.